Hi, my name is Paulina Kivuila. I'm going to talk about communication and interpersonal skill. What is communication? Communication is the foundation of human connection. Everyone has their own preferred way of giving and receiving information. The best communication method depends on the person and the situation. We have two ways of communication: verbal or non-verbal. With verbal, we use spoken words. With non-verbal, we use facial expressions, gestures, eye contact, body language, and tone of voices. I'm going to talk more about non-verbal communications. With non-verbal communications, we use without using spoken or writing words. We use body language, and other non-verbal clues to share information and emotions. Works alongside verbal communication to improve understanding. Helps healthcare professionals observe and interpret patients' feelings and needs. Can sometimes be more effective than verbal communication, especially when a person is unable to speak. We have 5 types of non-verbal communication, which are body language, gestures, which is sign language, also called BLS, braille, and touch. With the body language, is more postural, facial expression, and eye contact can show emotion, confidence, or discomfort. With gestures, we go pointing, hand movement, and nodding help reinforce or replace spoken words. With British Sign Language or BSL, a visual language used by men deaf people to communicate. Braille is a tactile reading and writing system used by people who are blind or visual impaired. Touch is appropriate and consented. Touch can provide comfort, reassurance, and support in health and social care. The importance of non-verbal communication helps communication, emotion, and feelings without using words. Allows healthcare professionals to recognize a spoken concern and patient needs, can overcome some language barrier by expressing basic emotion through body language and facial expressions. It builds trust, empathy, and help and rapport between patients and healthcare professionals. It supports better patient and outcomes, increase patient satisfaction, and person-centered care. Challenges. Challenges of non-verbal communication are limited understanding. Non-verbal clues can be mistold or interpreted differently. Cultural differences are gestures, eye contact, any sign language vary between cultures and countries. Lack of self-awareness is people may be unaware of message their own body language is sending. Environment factory is more noise, poor lighting, physical barriers. Accessibility and challenges. Not all healthcare settings have access to BSR, interpreters, or Braille resources. Application for verbal communication. Method are five. There are 5 methods. First of all is dementia. Dementia, body language, facial expression, eye contact, and gentle touch can provide reassurance when speech becomes difficult. Second, autism and selective mutism is touch when appropriate and with consent. Gestures and visual cue can support communication for individuals with limited verbal speech. Third, deaf people, BSR, enable effectively communication and support equal access to the healthcare. Visual empowerment, or Braille, provides accessible healthcare information on promoting independence. Children, last one, children. Positive non-verbal communication such as smiling, eye contact, and a warm tone voice helps build trust, strengthen relationship, and support communication and emotional development. Non-verbal communication is an important part of health and social care. It helps healthcare professionals understand patients' emotions, needs, and concerns. British Council have stated around 55% of non-verbal communication is body language, all through the challenges such as cultural differences and misunderstanding. There can be reduced through training and awareness. Using non-verbal communication effectively supports person-centered care, builds trust, and improve patient experience and outcome. Thank you.